and caries, a word you may not have heard before, but a word I want you to remember. Caries you're not familiar with, but you may be familiar with tooth decay, cavities, which are really the end results of the preventable disease known as caries. I also want to talk about a dream I have to reconnect the teeth to the rest of the body. In the creation of a new model for oral health care focused on pregnant moms and preschool children here in Park City at the People's Health Clinic. Let me begin with some interesting facts about teeth. The first tooth to appear in a baby's mouth began its formation a mere 7 weeks after conception. The outer layer of a tooth, the enamel, is the hardest tissue in the whole body. It is harder than bone, but it also is the tissue that has the least ability to heal. Unlike skin or bone, broken enamel cannot mend itself. Babies are born free of cariogenic bacteria, cavity-causing bacteria. They acquire these bacteria early in life, usually from their mother, but also from their caregivers, their siblings, their playmates. It has been more than 10 years already that both the Canadian and American Academies of Pediatric Dentists have recommended that babies be seen for their first dental visit by age 1. It's not happening. The reason for that first dental visit is to detect the very earliest signs of caries and to assess risk of the baby developing caries later in life. Talking about risk. Caries risk assessment is really simple. It only takes a few minutes. And it doesn't require any specialized equipment. The first part consists of interviewing the parent or caregiver regarding diet, snacking, eating, what goes in the bottle, especially at night, brushing, the presence of fluoride in the water, and using fluoridated toothpaste. Yes, we're supposed to use fluoridated toothpaste even in very small babies. The second part consists of a brief visual examination to detect any early signs of caries in the baby's mouth, white spots, or later signs, brown spots, or even worse, cavities, and to assess the baby's risk of developing cavities. That risk is assigned to the baby once the data is all collected. It only takes a minute. And the risk is either low, moderate, high, or extreme. And it comes with recommendations for therapeutic interventions that match the risk level of the child. This system is known as CAMBRA, Caries Management by Risk Assessment, and it has been validated by many years of research at the University of California in San Francisco. With children under 5 that match the profile of high or extreme risk, therapeutic interventions include reducing the bacterial load of the parent, the mother usually. Hence the wisdom of grouping together expecting moms and toddlers in a new model for oral health care. In 2001, the National Institute of Health defined officially, and for the first time, caries as a transmissible bacterial infection. A transmissible bacterial infection.